What causes a false positive pregnancy test, and what are the chances that you actually get one? Welcome back to the FemHealth channel, a medical education channel by doctors for you. A false positive pregnancy test happens when a test says someone is pregnant, but actually they're not. This can happen with both urine and blood tests. Both of these tests measure a hormone called HCG, which is often called the pregnancy hormone. Before we get to how likely a false positive pregnancy test is, let's first understand why they can happen. There are 6 main reasons why a false positive can occur. One cause is something called heterophile antibodies. These are antibodies in a person's body that can interfere with the test and cause it to incorrectly detect HCG. A second cause is when the pituitary gland, especially in women going through or past menopause, produces small amounts of HCG. A third cause is when people are taking HCG as part of fertility treatments, which can also cause a false result. A fourth cause, which is rare, is that certain tumors can produce HCG even when a person is not pregnant. The fifth reason for getting a false positive is having other medical conditions. These can include infections, kidney problems, or autoimmune diseases. These problems can lead to substances in the body that confuse the test. Finally, the sixth reason for a false positive is that there is a technical problem with the test itself. So how common is getting a false positive pregnancy test? A false positive pregnancy test can happen in both blood tests and in urine home pregnancy tests. But honestly, it's very unlikely in both. In blood tests, which are also called serum HCG tests, false positives could happen in about 1 in every 1,000 to 10,000 tests. That is only 0.1% to 0.01%. This means that out of 1,000 people taking the test, only 1 would get a false positive. But what about in urine home pregnancy tests? False positives are even less common with urine pregnancy tests than they are with blood tests. This is because urine tests are less likely to be affected by the kinds of substances that interfere with blood tests. But it is possible that in rare medical situations, a urine pregnancy test might give a false positive. To handle a suspected false positive, doctors may repeat the test using both urine and blood samples, since some types of interference affect only blood tests. Also, if someone has a history of false positives, it should be documented so future tests can be interpreted with caution. If you're worried you have a false positive pregnancy test, then talk to your doctor about confirming the result.